Okay, so for the first ankle inverted sprain, for a treatment, you can trace the ABCs. So basically, with only one ankle, the injured ankle, you only move the ankle tracing the ABCs. You do 3 sets of 20 of that every hour until full range of motion is back. Notice how the only joint moving is the ankle joint. And Z. Now the next exercise you're going to do are calf raises. You want to do 3 sets of 20 of these, 7 days a week, for 2 weeks, up until 2 weeks after you're cleared. So you go up on your toes, hold for a second, slow release down. And you're going to do 3 sets of 20. 1, 2. And if you want to make it harder, you can do these on a step where your heels hang over the edge. So your heels go past your toes, and you have to then push up further, resisting gravity. This will help strengthen the ligaments around the ankle, along with provide stability because you're increasing pressure on the way down, thus causing your ankle to reinforce and work on stability. And then the third treatment for the inverted ankle sprain is single leg balance on a foam block, which we don't have a foam block with us. So basically you stand on one leg and you balance on that ankle for 20 seconds. So we'll hold it for 20 seconds. And then release, and you're going to do 5 sets of 20 on the foam block. Now, whatever you do to the injured ankle, you also want to do to reinforce the other ankle. So then you do it on the other side, but we don't need to do that for this treatment. So those are 3 treatment plans for the inverted ankle sprain. For the jam finger, you can walk on towards, and you have a tennis ball. You take the tennis ball and you're going to squeeze it for 10 seconds on, 10 seconds off. All right, and you can release. And then you take 10 seconds off and you do it again. That's just one exercise that you can do with the tennis ball. Then we have the weight class. Now usually these are hand weights class that you can squeeze. However, because we don't have it, you can use the same motion with a pair of scissors. And basically you open them up, close them, and you squeeze it for 20 seconds on, 20 seconds off. You want to do this 2 minutes every hour. And then for the third treatment of the jam finger, whatever finger is jammed, you do the same thing and you trace the ABCs. You want to do this at any opportunity you can. With the jam finger, you always want to make sure you emphasize keeping the range of motion. If it's jammed at the knuckle, you can work on just bending the finger where it's jammed. Bend and extend 20 times, and then take a break. And again, you can bend and extend at any opportunity you can. All right, and for the third injury treatment, we have the torn ACL. You're going to lay on the ground. No, the ground. And what we have is the patient is laying on their back with bending their knee, the injured knee. So say he has torn this ACL, we're going to have that bent. Now with the heel always staying in contact with the floor, you're simply going to extend the knee out and bring it back in. Your toes can be off the ground, it doesn't matter, but you want to make sure that your heel is always on the ground. You're going to do this exercise 10 to 20 times, once per day. There could be discomfort, but there shouldn't be pain. If there's any pain, you should stop the exercise. And you can stop when you've reached 10. All right, so now the patient can get up. You're going to lay on the bench in the prone position, so your stomach is here, your head is out here. All right, and so for this treatment, we have the static hamstring holds. The patient lies in the front prone position, having someone else provide resistance at the ankle. The patient contracts their hamstring, holds it for 5 seconds, then releases. So what we're going to do is I'm going to hold his ankle down. He's going to contract his hamstring, bringing his ankle, pushing up, so he's doing a hamstring curl, and go down. He's going to do that for 5 seconds, push up, and good. Relax, push up, and relax. Great job. The angle of the knee can vary, and you're going to want to repeat this exercise 5 times per leg, twice a day. All right, and so for the third exercise, we have step-ups. So you can get up. We're going to head over to the stair. And with this exercise, you're simply stepping up and down on the bench or stair and stepping down with the same foot you stepped up with. Stepping up and stepping down. You're going to do this 10 times, 3 rounds of 10 per leg, morning and night. So we're just going to do run round for now, and you could just do it on the injured knee. And that is the third and final treatment option for the torn ACL.